Well, the head of risk communication with the Nigeria Center for Disease Control, Dr. Yaya Disu, joins us now virtually. Thank you for joining us on the program. Schools have resumed, under another year of the pandemic and a fourth wave in Nigeria. And I also know the NCDC keeps sending out advisories, especially for schools. But are they listening? What have you gathered so far as to adherence to some of these safety protocols?
Thank you very much, Millicent, and good evening, viewers. I think before now, we've already developed guidelines that we have reviewed several times with each wave. For this one too, and there are other new measures that were not there before, like vaccination, and then now we're including them, especially for staff and visitors who are coming to the school premises. We have vendors and other people who have business to do. The guidelines are actually informed by science, and it's basically about hand hygiene and physical distancing, wearing of face masks, things that we know that can prevent transmission of this virus from person to person. The additional thing about this is about detection of cases in school. Over time, this is where we have gotten challenges. And most schools may not be reporting these cases. And then I know that Lagos State government, each of the waves in the past, they've reported cases from schools. And then we still need to do more in terms of sensitizing parents, staff, as well as students, for them to be able to report these symptoms. And there must be designated officials in each school, and probably a team that will be able to link up with the local government disease surveillance officers or the state disease surveillance and notification officer who could then follow up with these cases. I think we need all stakeholders to work together, the Ministry of Education, UBEC, and then other relevant stakeholders, Ministry of Health, as well as the community, Parent-Teacher Association, as well as even Old Boys Association in schools where they have Old Boys such associations. We need to all work together, especially when we are having the fourth wave. We've just finished the Yuletide season. People are just returning back to resume activities, businesses, schools, and it may be too early to be able to say this is the trend, but over time, it will surely show. But if we put all these measures in place, then we are very sure that we'll be able to control this. Then another thing that is driven by data is testing. And then now that we have a rapid diagnosis test kits available, and then it's just to empower the schools or link them to health facilities and the State Ministry of Health that can facilitate this.
Now that you mentioned testing, Dr. Disu, I was just going to, if you could answer that also with, the latest epidemiological situation report from your agency and what it's telling us if we've actually reached the peak of the fourth wave with the declining cases.
Well, sorry, I didn't hear that.
Talking about the epidemiological report from the NCDC, what is it telling us now? Have we peaked with the fourth wave? We're seeing a number of cases that are coming down.
Actually, at the peak of the Yuletide season, generally services and at various states may not be at peak. So people may not be reporting, especially people who travel away from the city centers. It is now that they are returning in the next 2 weeks. And then when activities fully resume, when most businesses start requesting their staff to go and do tests, especially those of them who are symptomatic. And then that way we'll be able to know the real trend. Now, it's too early. People might be having symptoms, may not be reporting. Some might be in villages, rural areas where they may not have access to prompt testing. And then, but in the next 2 weeks, I'll be able to know where we really are with this pandemic. But the NCDC is working with the states, Ministry of Health across the country in order to ramp up testing. And then we have reviewed our national testing strategy and then to ensure that people can easily access this testing with RDT, build capacity of various organizations, and for them to be able to use this and link them to the national database, so that whatever case that is reported and confirmed and can also be captured in the national database. And then we'll be able to understand the burden of the disease and we can inform further actions.
Dr. Ayadisu, Head Communication with the Nigeria Center for Disease Control. Many thanks for joining us on the program.
Thank you very much.
We have more on the pandemic updates when we return. Please stay with us.